Hi there, and welcome back to Soton Brain Hub. My name is Calvin, and today we'll be talking about carotid atherosclerotic disease and some of its potential treatment options. Let's start with a brief recap of the relevant anatomy. The common carotid arteries are the major blood vessels providing the blood supply to the brain. We have two common carotid arteries, one on either side of the neck. The left common carotid artery branches directly from the arch of the aorta, whereas the right common carotid artery arises from the splitting, or bifurcation, of the brachiocephalic trunk into the right common carotid and right subclavian arteries. The left and right common carotid arteries travel up through the neck, lateral to the trachea and the esophagus. They do not give rise to any branches in the neck. At the superior margin of the thyroid cartilage, approximate vertebral level C3/C4, the common carotid arteries split into the internal and external carotid arteries. This bifurcation occurs in an anatomical area known as the carotid triangle. The internal carotid arteries do not supply any structures in the neck and enter the cranial cavity via the carotid canal in the petrous part of the temporal bone. Within the cranial cavity, the internal carotid artery supplies the brain, eyes, and forehead. The external carotid artery supplies the areas of the head and neck external to the cranium. It travels up the neck, passing posteriorly to the mandibular neck and anteriorly to the lobule of the ear, and gives rise to 8 branches in total. We already have a great video covering the branches of the external carotid artery, so be sure to check this out if you'd like some more information. Let's now talk about the atherosclerotic disease process itself. An atheroma is a collection of fatty deposits that can build up in the walls of arteries over time. An atheroma is more commonly known as an atherosclerotic plaque, and these two terms are fully interchangeable. Atheromas form along the inside lining of the arteries, in an area called the tunica intima. As they thicken, they can interrupt blood flow by narrowing the lumen of the artery. This narrowing is often referred to as a stenosis. Importantly for carotid disease, an area at the bifurcation of the common carotid artery, called the carotid sinus, can often produce turbulent blood flow. This greatly increases the risk of atheroma formation in this area. Atherosclerotic thickening of the tunica intima of the carotid arteries will result in reduced blood flow to the brain and cause a variety of neurological symptoms, including headache, dizziness, and muscular weakness. If blood flow is completely occluded, a stroke may occur. Additionally, in some cases, pieces of the plaque can break away entirely. In response, the body may produce a blood clot, which can further block the arteries. If atherosclerosis of the carotid arteries is suspected, a Doppler study can be used to assess the severity of the stenosis. Fortunately, we have a few key procedures that can be used to treat carotid atherosclerotic disease to prevent the narrowing of these very important arteries. Firstly, a surgical procedure called a carotid endarterectomy can be carried out using either local or general anaesthesia. This is indicated in patients with a moderate or severe stenosis of a carotid artery who have already had a stroke or a transient ischemic attack. During the procedure, a 7 to 10 cm cut is made on the side of the neck, and then a small incision, called an arteriotomy, is made along the wall of the narrowed section of artery, so that the atherosclerotic plaque can be surgically removed to greatly improve the flow of blood. The artery is then closed with stitches, or a patch, and the skin is also closed with stitches. For a carotid endarterectomy, the risk of having an intraoperative stroke caused by the procedure is around 2%, but this may be higher in patients who have already had a vascular event. Additionally, there is a risk of damage to important cranial nerves, specifically the vagus and hypoglossal nerves that pass nearby to the site of the procedure. An alternative to carotid endarterectomy is to treat the stenosis in the carotid artery with a stent. This is a much less invasive procedure that can often be carried out under local anaesthetic. The plaque in the artery wall is not removed like in an endarterectomy, but instead a thin flexible tube called a catheter is inserted into an artery in the groin and then gently threaded up through other arteries in the body to eventually pass through the plaque in the carotid artery. The narrowing is then dilated with a small metal coil that is attached to the catheter. This stent is often left permanently in the artery to help prop it open. This improves blood flow through the artery and reduces the risk of clots building up and causing strokes in the future. The evidence shows that this procedure is successful at reducing the risk of stroke for symptomatic patients with a significant carotid stenosis. However, the results of stenting can show a higher stroke rate than for carotid endarterectomy. Finally, a procedure called a carotid angioplasty uses an almost identical process to stenting to pass a catheter through the narrowing in the carotid artery. Instead of a stent, angioplasty involves the inflation of a tiny balloon attached to the catheter at the site of the atheroma to help widen the artery and improve blood flow. It is important to note that angioplasty and stenting are often used in combination and have particular use when a procedure like an endarterectomy isn't possible or if it carries too much risk for the patient. Thank you for watching this video. Remember to like it if you enjoyed it and subscribe to the channel for more videos like this and others related to the anatomy of the head, neck and brain.
Find us on Facebook, Instagram, and subscribe to our YouTube channel to help explain the mysteries of the brain.